All right, so this is fraud and compliance point number 3. Point number 3 is that you have to make sure that when you have a compliance plan, that it doesn't just sit up on the shelf, that you literally take it out and you sit down with your staff once per year and you go through the entire compliance plan. Now you can do this one-on-one, but I recommend you do it as a group. If you have a regular staff turnover, it may be a good idea to videotape you taking your team through the compliance plan. That way, when you have a new staff member come on, you don't have to take the time, or the compliance officer doesn't have to take the time to sit down and take the staff member through the entire compliance plan. If you have a video of you taking your staff through it, then when you have staff turnover, you can then just have the new staff sit in with your video and the compliance plan in front of them, and they'll literally be taken through the plan by you. And then what you have to also do is you have to remember that every single year, the entire staff, whether they've already been reorientated to it at one point or another, they have to be reorientated to it again, each and every single year. So make sure that you not only take the new staff and your existing staff through it, but every single additional year, each additional year, you continue to re-go through the compliance plan, and everyone then signs an affidavit that they understand the compliance plan fully and they've signed off on that fact, and they do that each and every single year. And I mentioned it before as part of point number 1, but it is also important that you reorientate the staff during that compliance plan training, that there is a drop box. It's an anonymous drop box. It is a place for them to report anything that they feel is out of place, and that they can then report that to the compliance officer without any risk of retaliation. The main reason for that is, if you have a staff member who is fired, quits, or for whatever reason is disabused with the clinic, and they then at some point later say, oh, well, this such and such happened. This thing was happening that was illegal. It's very important that you have had that drop box, because then you can say, well, if that's the case, then why did you wait 6 months to report it when you had a drop box that you could report without any risk of retaliation, an anonymous drop box, and you didn't do it? That holds a lot of weight so that people can't file false claims against you. And the truth is 90% of those claims that happen to the doctors from staff members are false, because for some reason the employee was disgruntled. So having that drop box saves you from a lot of pain and suffering with regards to disgruntled employees. So please do me a favor, make sure that you take advantage of not only a compliance plan, that you reorientate your staff and have them sign the affidavit, but that you also have a drop box that's anonymous. Thank you.